meaningful practice. Joining us in this episode is Leomil Adriano, a manual physical therapist at the Somatic Health Providers Association. He's also an osteopath and an acupuncturist. He is as well a consultant for the Philippine Sports Commission. Hello, Leomil. Let's start with that. How did you get into this practice of alternative medicine?
Well, it started way back when I was still in college. I was like third year, and I was playing for the college of physical therapy then. And then it so happens you encounter a lot of injuries with your teammates, right? So I have to find a way where I could teach them right away so that for the next game they'll up and ready.
But there is a science to that as well.
Yeah. So being a physical therapist, you're being trained to do these exercises, to do these different modalities. And sometimes if you're into sports, you have this pressure, right? Like, for example, the coaches would tell you, I need this player right away. Probably in the next 2 days, I want the sprain gone.
You need a quick fix.
So I have to look for ways that I could at least eliminate the pain or make them more functional for the games. So that's when I get into these kinds of things. Yeah.
So there is such a thing called acupuncture. You've been in that for 7 years, and you've also been in osteopathy for 5. What's the difference?
Well, for acupuncture, it's a Chinese system. At least originated from China, they say that when you insert fine needles into a certain point, in a way it balances your energy, makes you put you in a position of healing. While with osteopathy, it's like more like a hands-on healing, manual therapy. It's a natural way wherein the practitioner uses intentional touch and some movements so that the body would heal its own. So, for example, you have a cut, right, and then you wash it out and make it have an environment for healing, then it could heal it on its own.
So here you're talking about, was it muscle, nerves, just tissue? What is it?
You're looking at the person entirety. It's more like a mixture of musculoskeletal or muscle, skeleton, nerves, soft tissues, cartilage, and even sometimes spirituality and psych. So,
but is there something there that the regular physical therapy won't be enough for?
It's a complementary thing with the physical therapy background that I have.
Just how did you get started in this? You have a physical therapy degree from UST, but how did you get into the practice of alternative medicine?
Well, like I've said, I have to look for ways where I could make my players be more functional in the shortest possible time.
So it's more applicable to you for your team?
For my team first. And then when I graduated, I worked with a chiropractic center and a good chiropractor. And most of the therapists there are doing osteopathic skills and techniques. So I got a little bit acquainted or familiar with the stuff that they're doing. And since I'm also a physical therapist, why not do the whole thing? So that's when I get into these kinds like acupuncture and osteopathy. But
a regular medical practitioner can't just jump into physical therapy, this type na may specialization, o pwede rin niyang simulan? As
of now, there's no rules or regulations yet for osteopathy. But with acupuncture, they already have set of rules. For acupuncture, they already divide it between certified acupuncturists, wherein these people might have just small backgrounds with anatomy and physio, and they also have the certified medical acupuncturist. Most of the practitioners here are doctors.
And the certification, how exactly do you get that? With just those minimal requirements, you're good to go?
Requirement-wise, it's quite extensive. So you need around 500 anatomy, 500 physio. That means hours. 500 hours of anatomy, 500 hours of physio, and some other sciences like even aseptic techniques wherein you have to keep your hands clean and all those stuff. With osteopathy, in the US, it's more like you have to be a medical doctor first before you practice osteopathy, or you have to be in line with medical practice before you can do osteopathy. But in certain countries like the UK and some other countries in Europe, you could go directly as a bachelor's in osteopathy or a diplomate in osteopathy.
In theory, this all sounds understandable, no? That there's a progression from school to specialization, etc. But are there necessary skills that come with actually practicing one or the other, acupuncture or osteopathy?
Skills-wise, you have to be first open-minded. Started as an alternative medicine, so not everyone would accept alternative medicine,
That's
right? The other one would be diligence, because it requires a lot of palpation. You have to memorize a lot of points, a lot of stuff, a lot of muscles. Even with physical therapy, with good physical therapy background, you could easily get into osteopathy and acupuncture because you really have to learn the different muscles and different function of that muscle. So it has a good carryover if you're into those kinds of bachelor degrees. But osteopathy on its own requires you more of the palpation skills and a lot of empathizing with patients, because you have to feel what they feeling and at the same time help them get out of that whatever pain.
If that's the case, then Filipinos aren't really strangers to osteopathy, kasi hilot is practically ours. We even raise kids on massages even from babyhood, no?
Yeah, actually for some reasons, I think Filipinos are more adapted to these kinds of techniques. Like, for example, we have the first class of osteopaths that will graduate this June, and most of them are trained with lots of touch. And then it's not a hard thing for Filipinos because we like to be touched and to have the so-called hilot, masahe, right? But just to give it a little bit more of this distinction between massage and manghihilot, we turn to make it more, in a way, scientific. Like, you have to know your anatomy and physio for you to do this stuff. And
there are schools that actually offer these courses?
Osteopathy, as of now, none yet. None yet here in the Philippines. We're hoping to get a school somewhere south that has autonomous function. But
and are more open to alternative healing techniques.
And to manual techniques. Because as of now, there's no school yet. But the one we have topped right now is a school from Ontario, Canada.
So overseas, meron na syempre,
yes,
no? It's been carried.
So what they do is, they go here and teach the Filipinos how to do the osteopathic
So you
techniques.
see it happening soon? No, we're opening up.
Yeah, actually the first batch is about to graduate this June, and we hope to have a school probably by June or latter part of the year.
But then, despite the openness for osteopathy, probably because of the familiarity, acupuncture is something else entirely. You're talking about needles, and there's a lot of misconception that comes with that as well. Name some of them, probably, na may hesitation coming from the public.
One is that it stings. It's painful.
Okay.
No, it's not painful. It's just that we often correlate it with the injections or the syringe that we use in the hospitals or in the clinics. The difference is that those syringe has a hole to push the medicine in. These needles don't have those, so nothing that could rub or tear on the skin.
And these are also just to what point of the surface, probably?
So surface-wise, you insert up to the. Well, as an acupuncturist, you will learn the feel. That's the point.
Okay. And so, no miss yun, No miss yun. Walang mapaparalyze.
No. And there are some, there are certain levels. Like, for example, if you're only trained up to this level, don't try what the doctors are doing. So,
what would be the most basic, probably starting out? With the needles.
With the needles, it's more of like how to keep your hands sterile. That's first. And the next one would be to feel for the points and to have the measurements for the points. And actually, insertion of points is quite a small part of the whole healing process. It will be more of the understanding of the body itself that is more important. And what the need is. What you're actually treating. We'll get into that a little more later, but as for benefits, what are the benefits of acupuncture on one hand and osteopathy on the other? Okay, osteopathy is like a natural form of healing. So the benefits is, if you're an osteopath, you tend to focus more on what the person is feeling. So, for example, there's a strain, right? So the strain might be caused, for example,
Pulled muscle.
Pulled muscle. So your focus would be more on the contraction of that muscle and how to elicit the relaxation of a particular tight muscle, right? For example, the needle, the acupuncture. After a series of questions and a series of assessment, then you would have to decide which points you have to puncture.
Not to mention, what you're treating isn't always even physical when it comes to acupuncture.
Yes.
What is the range of needs that acupuncture actually addresses in terms of conditions?
A lot of, but for me, being a physical therapist, it aids me more with back pains, muscle tear, neck pains, spine pains, vertigo, headache, and even some cramps would help. But that's only limited to me because I'm a physical therapist and I'm an osteopath, dealing more with musculoskeletal. But if you would talk to some other practitioners who are like doing this for a longer time,
you can go into arthritis,
stroke,
CP,
or cerebral palsy, kids, dysmenorrhea, even for
or
some
even
people.
Something as simple as memory.
Yeah, memory would also.
Actually, now that we're at it, I hope we have time. Maybe you could like try one on me.
Sure.
Should we try one? Probably with a needle. I'm not too scared of needles, but this is going to be first for me. So, sige, where do we start?
Okay, so I'll just have to measure, and I'm
Okay.
puncturing the so-called PC6 or pericardium 6. So if you're going to measure it,
no bleeding involved yan, ah?
yeah, hope so.
So here we're going to try to hit on what area?
Called the pericardium 6.
So we're going to try to hit on memory and stressors.
Yeah.
Stress points.
Yeah.
Okay. So this is a clean needle we're working with. It's not going to hurt.
No, it's not. We want to put it here,
Okay.
so for better puncture.
And it's going to stay standing on my skin?
Yes.
Okay. And how long is that supposed to be for?
This is good for at least 5 minutes would do.
Okay.
Actually, once you insert it, there's already an effect. So we just let it in for a few minutes more, so that there'll be what you call a longer lasting effect.
So I should call you if it works.
Yeah.
And it's actually standing like under the surface, but it doesn't hurt. That's true. Okay.
How's it feel?
Well, I'm calm, not stressed at all. So I guess is that a good thing?
Yeah. And then others would do it like this.
So how much can you have? How many needles can you? Oh, okay. Medyo may na-feel ako doon, no?
What's that?
So that's like a current running through.
Yes.
Okay. What does that do?
Okay, we call it the dechi.
Okay.
It's a sensation wherein you might feel current. Others would feel heaviness. Others would feel cold, warm. Others would just feel nothing at all.
So for people who just want to restore some sense of balance again in the way they probably circulation or whatever, this is a good goal.
Yeah, actually we could consider acupuncture as one of the cheapest form of
And it's cost
balance,
effective. Yeah, you're saying it's cost effective, so it's an option. And you would recommend that people try it?
Yeah, very much.
If they don't want to go full head on with any particular medication. It's a good way to go. Well, on that note, Leomil Adriano, maraming salamat.
Thank you.
Thank you.
Thank you.
We'll talk more about alternative healing and how you can have a career in this field after this break. Stay with us. Shop Talk will be right back. Welcome back to Shop Talk. We're still talking about careers in alternative healing, and still with us is Leomil Adriano, a manual physical therapist at the Somatic Health Providers Association. He's also an osteopath and an acupuncturist. And just a while ago, I got my first try of acupuncture from him, and we were hitting this area.
Yes, pericardium 6.
Again, the pericardium 6, and that's also the point where you want to deal or manage stress, right?
Yeah,
but then we're talking about here a career in acupuncture or osteopathy.
Yes.
And I'm wondering whether there is a demand for this profession, whether here or overseas, and what's it like?
Oh, here in the Philippines, it's since this is we had the first group just about to graduate this June.
In June, you mentioned.
Yeah, but the demand for everyone now is looking for something more natural, right? And it's more, as I've said, more cost effective. So there are a lot of techniques that anyone could do just to be more balanced, right? And the demand is like, I think now there are only 2 or 3 of us who are already osteopaths. So we're doing this more with clinics and others, private clinics. So there's a lot of people. Like, for example, there's a research that shows that 80% of the world's population would encounter low back pain. So if 80% of the world's population would have back pain, you might consider how many people would have back pains here in the Philippines, right?
And there would be, of course, advantages, maybe disadvantages in being in the field, do you think? Apart from what we mentioned about misconceptions that people might be not too warmed up to the idea.
Like, for example, with acupuncture, it's like you have to puncture them, so would it hurt? That's one. People usually try to evade pain. And the next one is for osteopathy. It's like, it's a new thing, right? People would ask you, what again? Osteo, does it mean bone, right? Or do you have to crack my bone like what other professions are doing?
Chiropractor pala yun.
That's our brother. Yeah, and then there are those like, what do you do exactly? Because sometimes you are just seated. If you're not the patient and you just see how an osteopath would work, you would see them just sometimes seated at the head, holding onto the head and doing sort of nothing. So, but if you ask the patient, and if the patient is really in need of this kind of treatment, they would say, this is the first treatment that I have done, wherein I have a source of sort of release. So those are challenges, because sometimes they could just try to evaluate not from experience but just from the way they see a thing.
Isn't that hard though? You have to as if go back to the kind of treatment that they've actually had done and undo it?
Yes, in a way it's hard. But sometimes it's not, you don't really care much of what medicines or what are the things that they've done before. What you're more concerned now is what they're gonna do for this particular time, for that particular patient.
You're mentioning challenges in the profession now, and definitely we mentioned earlier that misconception might be part of it. Do you think, in as much as Filipinos might be closer aligned with osteopathy kasi medyo malapit sa hilot yon, hindi rin ganun kadali for acupuncture?
Yes, mahirap in a way, because many people feel na when you do insertion of needles, some would also think naman na if it doesn't cause any pain, like what you said, it's not effective, right? Or it's just a needle. How could it help me have that restorative capabilities? So it's hard to convince them. So I usually tell them, try it first. Then maybe you would have a change of heart for these kinds of systems.
Would you say that probably Filipinos also need to get warmed up to the idea first? Maybe there's a lack of awareness on what these alternative healing options are.
Yeah, that's what I think. People are just most often than not open to this kind of ideas because first they are scared. Second is that they are not yet well educated. So you have to educate them on how these things really works. And sometimes we do this through sort of like osteopathic measures or field treatment, acupuncture treatments. So the people would feel that, oh, it has an effect, and probably it's worth trying for me if I have these kinds of ailments or dysfunction.
Definitely you are into physical therapy, no? But going into alternative healing, that approach, has it been more financially rewarding?
Yes, in a way, yes. Because people would, if we're going to segment it, right, many people would consider first the mainstream physical therapy first, right, or some other forms of medicine, which is more allopathic, like taking medications, taking drugs, or taking pills. But once they have for some reasons they feel that they should try a different approach or something is not working, that's the segment that I'm targeting. People who have done this and tried this but seemingly not too happy with their with their results. That's my target segment. And
this segment clearly has been the sports for you in your
most
case.
of the time it's sports, and now there's a growing population of the elderlies. So elderlies doesn't want, because if you're going to look at elderlies, or they call it the geriatric population, most of them are taking 7, 8 medications, and some of it may have some reactions in each other.
Side effects.
Yeah. So
What does this do for them then? How does it solve that problem?
well, for example, acupuncture will help them to at least, if you're looking for the main source of the dysfunction, then you have to use your rationale and your assessment based on this the acupuncture principles, right? And with osteopathy, if you believe that the body could really heal itself, then you don't need that much medication.
Lionel, just siguro a final word
Yeah.
now, advice to those who want to get into the career, because it's obviously interesting enough as it is.
Okay. First of all, you have to have an open mind, because it's not really your mainstream thing that you would gonna do with osteopathy and acupuncture. Also, you have to be diligent enough to try this out, because it's not really that easy to do this. But I'm telling you, it's somewhat rewarding in sense, because you'll be able to help a lot of people in the natural way possible.
And I'm going to be the test of that, but even as we go, I'll probably ask you to do one more point for me. But thank you for watching Shop Talk. I'm Caroline Howard, sitting in for Ria Tanwat Cotrillo. Follow ANC Shop Talk on Twitter and be a fan of ANC Shop Talk on Facebook. Thank you, Lionel. Join us again tomorrow. Enjoy the rest of your day. Sige, let's try that.